Good morning, and welcome back to Good Samaritan Facebook Live. My name is Dr. Scott Stine. I'm a family physician here in Vincennes, Indiana, and Chief Medical Officer of Good Samaritan Physician Network. I'm joined by Adam Thacker this morning, who's our Chief Operating Officer at Good Samaritan Hospital. We'll be giving you an update today on the status of COVID-19 in our community. We'll talk a little bit, as usual, about testing, what's going on in our community as far as the progressive opening of services over the course of the past week or so, what's been happening with the hospital. We'll touch on a little bit also about a very important study that was done by the Fairbanks School of Epidemiology up at Indiana University over the course of the past week, and also take your questions as well. So just to kind of lead off, Adam, our update this morning on number of tests looks like around 588 tests that were performed over the course of the COVID response, and it looks like we're still at about 22 as far as positives concerned. So important thing to realize is when we look at over the past 3 weeks or so, the total number of positive tests that we've had new has really only been a couple tests over that period of time. The other important thing to realize is during that period of time, almost all but one patient has come off of quarantine during that period of time, and so all of those patients have been recovered. We are pleased with the fact that the openings have gone well. Our local health officer, Dr. Stewart, has been very carefully monitoring what businesses are opening and the strategies that they've come up with on their own to determine what the safest manner to continue to conduct business has been. We're looking forward to the next wave of that opening, which will be on the 24th of this month. And so far, things have been going very well. So I'm very encouraged by the fact that our population is getting back out, and we haven't seen a big increase in number of positive tests so far. The hospital likewise has been increasing services and opening things up. You want to talk briefly about kind of where we're at on that?
Sure. So 100% of our services are reopened. As many aspects in the community, there are schedules that have been modified, social distancing and waiting rooms have been modified to make sure that we're doing that in the safest manner possible. But as we've mentioned many times, it's so important to be seeking your healthcare needs, COVID-related or not, and getting those needs met in a timely manner. So we're here to do that. Services from rehabilitation and therapies to diagnostic imaging and testing and screening to the procedures that you've heard a lot about, starting with outpatient procedures and now our inpatient procedures, those that may require a stay after the procedure in the hospital are reopened, and we're continuing to monitor that. As Dr. Stine mentioned, due to the very low transmission and actually only one active case in the community, feel very confident about that. A topic that usually spawns into is the visitor aspect of it, and we are staying very diligent with our visitor restrictions. Again, have the absolute knowledge that having family involved with care is important and part of the recovery process, but we're balancing that with as things reopen and as we've seen a lot of information around asymptomatic individuals that we'll talk more about related to the Fairbanks study, universal masking, screening of everybody coming in the door, restricted entry points into the hospital still remain in effect, as well as visitor restrictions for patients that are in the hospital. And we're following those based off of Indiana Hospital Association guidance and also our Southwest Indiana Patient Safety Coalition. So all of the hospitals in the Southwest Indiana region are following the same visitor restrictions, and really feel like that's important to keep our healthcare team safe, our patients safe, and the visitors that are in the building safe, to where we can make sure that we maintain social distancing and safe practices during this time. We hope to reopen some visitor aspects June 1st, and we're continuing to monitor that, but that next stage of the Back on Track plan, May 24th, we're going to see how that goes and what if there are any increase in cases, and then we'll start to relax some of our visitor restrictions, ideally June 1st, but it's a fluid situation.
And as Adam alluded to, we started a universal masking policy this past week. A lot of people have asked, why did we go to universal masking when previous to that we didn't? And the primary reason is we want to make sure that people are comfortable coming to receive their services, not just at the hospital, but also in our ambulatory offices. There have been a lot of people that have been waiting a long time to get back in to see their providers. We want to make sure that they are comfortable and they're safe in that environment. And that's one of the reasons that we started that universal masking policy just recently. It's important to realize that as you go out in the community that you'll see a whole variety of different responses to this. Some people that are wearing hazmat suits from head to toe, and some people that are wearing no masks when they're out in the community. And I think as we move forward, one of the important things to realize is we're going to be talking about different populations and different risk as we go through the summer months, as we talk about schools reopening in the fall, and also as we move into our next cold and flu season, which will be next year. And it's important to still realize that the population that we are most concerned about is the population over age 60, 65, and then of course the population that has any kind of comorbid medical conditions that would make their immune systems have a more difficult time dealing with this. One of the things that we talked just briefly about there was the Fairbanks study. I think we're all excited to see that now we're getting more data. It was announced a month or so ago that there was going to be a study performed by our local university with Indiana State Department of Health and the Fairbanks School of Epidemiology to roll out a study looking at a cross-section of our population. And I think that's really exciting to us because there's been such limited data thus far on what percentage of the population has been infected and then also what percentage of the population maybe didn't even have symptoms associated with this disease. And so Adam and I were talking a little bit this morning about those numbers, and it's kind of exciting to see that first wave, which was around 4,700 patients or so, which has been done and will continue to be performed on a monthly basis, was released last week. Those numbers are interesting in the fact that probably the most important thing that we saw was a very small percentage of the population was infected, around I think 1.7% or so tested positive. And then of the patients that tested positive, there was only about 44% of those patients that really didn't have any symptoms, which is exciting. It's exciting to us to know that these patients are potentially being exposed and developing antibodies and really not having any symptoms associated with it. And I think as we roll forward into the course of the next several months or so, there's going to be additional data that we'll hopefully see as to whether those patients were infected during that time, whether they weren't infected during or infectious to other patients during that time, and what we do with that as it turns into vaccine time coming towards the end of the year. So that's kind of the next big step is making more of our decisions based on some of that data as it comes out. As we talked about over the course of the past month or two, we like to make our decisions based on good data and not just come up with these things on our own. We've been very fortunate here in our community because our viral load, as Dr. Stewart likes to refer to it, or the number of patients who have been carrying the illness has been very low. The number of positives that we've had have been very low. And although we've had a few cases coming in here and there over the course of the past several weeks, some of those positives have been from outside of the county that we've tested. And again, the ones that we've had here locally have really been isolated beyond what the CDC has recommended and recovered.
Yeah, and I think to add to the 44% asymptomatic, there's a lot of fear and angst that we hear about with there's this population that has the virus and they're asymptomatic and they're getting everyone sick. That is not necessarily true. And as Dr. Stine mentioned, more information still to come about, but we don't know today that if somebody is asymptomatic, they may not be contagious. I think what we can take away from it as a factual statement is that 45% of those individuals tested positive for the virus were asymptomatic. That means the virulence of the virus is not so high that everybody's being hospitalized or that there's a really high death rate. What we know is that over the age 65 have comorbidities, high risk, lung disease, heart disease, those types of patients that are medically vulnerable are at higher risk for poor outcomes. But the rest of the general public may contract the virus, be asymptomatic, and have a relatively uneventful event with the virus. So that's a positive thing to take away from this study, and we'll continue to learn more. Another roughly 5,000 individuals will be contacted for being studied in June. I would just put a plug in for Fairbanks that if you get a postcard or a phone call about participating in the study, please do so. It does provide a lot of good information, and key decisions can be made off of that around how we reopen, what the precautions that need to be taken are, and just understanding the progression of this virus to a greater extent.
And as we go through each month, this will be performed. Around 5,000 patients will go through this study. And so again, as Adam said, we want to make sure that people participate in this because as we roll through each month, we're going to have more and more data and more information that helps us to make decisions as we get into the fall, as far as school reopenings, as far as vaccines that may become available. All of those things can be based on more solid data. So that's one of the important things to participate in if you get called. A few of the other things that changed over the course of the past week was convenient care and respiratory clinic became one again.
Right.
And we've actually seen a fairly large volume of patients going through there, but I think that's because of a whole variety of other medical problems going on this time of year.
Right.
We saw over the course of the past several weeks probably more chainsaw injuries and home improvement injuries than I would normally see at this time of year because people had projects going on. So those two clinics have now been put back at the same location. That's going to be a park and call type arrangement, basically so we keep that population separated from folks that aren't respiratory type patients as well. And the other thing that has continued on that really started up kind of midweek last week was the Optimum testing sites. You want to talk a little bit about that?
Yeah. So OptumServe is the contracted testing site for the state. There is one here in Vincennes. As of last Wednesday, they stood up an additional 30 sites, so there are 50 sites statewide. Those sites are ran by Indiana State Department of Health in partnership with OptumServe. They're not part of Good Samaritan, but they do have a access point for being tested for coronavirus. Symptomatic patients as well as any asymptomatic patients over the age of 65 or in that medically vulnerable high-risk population can be tested. There is an online screening tool that they utilize, and then you get an appointment to be tested. Currently in Vincennes, that site is at the National Guard Armory. I know they made comments this past week about potentially moving that site. I don't think there has been a lot of activity at the Vincennes site as far as being tested. I can't speak to the sites outside of Knox County. What I would say is if you are utilizing that as a service, which is perfectly fine, and we are your medical provider and you're seeking care, making sure to communicate that you've been tested, the results of those tests, all of that information is really important for our healthcare team to make sure to provide the best care possible. But we'll continue to stay in close contact with State Department of Health as that evolves and as those testing sites are being ran here locally.
One question that I know has come up frequently amongst our local employers and some of the larger organizations has been testing of their entire facilities.
Mm-hmm.
And I know we get asked this on a relatively routine basis as to the utility of that and the availability of that. And that's certainly something that we've been discussing. I think it's important for everybody to keep in mind, though, as we've talked about in the past, that if an entire organization chooses to test all of their employees, that's a snapshot in time.
Right.
And I know that is in some ways reassuring to folks, but as we go over the course of the next several weeks and months or so, there will likely be some strategies that come out specifically focusing on hotspots, because as we know, there have been some areas around the country and even within our state that have been some hotspots. You want to talk a little bit about some of those places and some of the areas that we want to continue to watch?
Yeah, so nationally, you've heard of the hotspots that were New York, New Jersey, out on the West Coast, Washington, other areas that have popped up as we're continuing to see nationally that trend downward. Now we're really using that hotspot definition locally as more of what's a hotspot from a potential employer, plant-based situation, and there are employers that are looking at source testing, which means they're testing all of their employees. We partner with employers to have that conversation about, just as Dr. Stine mentioned, it's a snapshot in time. If a employer is seeing a number of positive cases, then that makes sense to have that conversation, and especially knowing that asymptomatic piece. We want to partner in that. We have a response team that works on, okay, what's that testing look like, and the processes that get followed, also working in close concert with Dr. Stewart's group and the Knox County Health Department as moving that forward. If there are employers that don't have any positive cases, given the low transmission in our community, that may not provide a lot of value. But at the same time, there are employers that are wanting to do that, and we work through that. Certainly, you've heard across the state that factories, processing plants, places where there's a large number of employees that are working in close contact with one another. Those are areas that are of high risk and can become our own regional or state hotspots. So we evaluate those and are looking to, the goal is to identify if there is an outbreak as fast as possible and to take the remedial actions of isolation and quarantine. And so where that's appropriate, we're partnering to do that.
One of the things that comes up this time of year also is wellness. We spend a lot of the winter months of our year looking at illnesses and trying to treat those illnesses. And as we roll into the spring and the summer months, we talk about getting kids in for their annual checkups, for wellness visits, for sports physicals, things like that. We're all hopeful, of course, that our kids get to go back and play sports over the summer and into the fall. So we definitely want to encourage people to make sure and be in contact with your primary care providers and get in for your wellness visits, because as we've said, the likelihood of that illness coming up in our community right now is very, very low, and especially in the pediatric population, it's important to get those checkups and get sports physicals taken care of this time of year, because this is a wellness time of year to get things taken care of. One of the things that has come up in the pediatric population that people have asked about is this pediatric multi-system inflammatory syndrome that's associated with COVID-19. I think it's important to realize that as the reports came out on that over the course of the past couple of weeks or so, the number of those cases that have been identified and reported is extremely, extremely, extremely small when we look nationwide. And I think the other thing to keep in mind is this is not something that's new. We see this with a variety of other viral illnesses that go around with associated illnesses like Kawasaki's disease and other autoimmune processes, where the pediatric population, basically their immune system attacks their own bodies in response to the viral infection. So a lot of questions have come up as to whether we should be more worried about the pediatric population. And what we have seen, looking at the studies that have been done so far, is that the occurrence in that population is extremely low, and that the severity of the illness in that population is extremely low. And so I wouldn't at all be reticent or concerned about that population right now. We will continue to watch that and kind of follow along from a nationwide standpoint to see where all that's going. But as you see more about that in the media, that's something that it's interesting, it's new, it's something that they're reporting because it sounds so terrible, but it's also something that we see all the rest of the time with other viral illnesses that go along. During my time as a primary provider over the course of the past 20 years, I've seen only a handful of Kawasaki disease cases, and our pediatricians who see lots of pediatric patients only see that a very small percentage of the time. So it's important to realize that that's something that is not at all common, and if people are concerned about that, please contact your primary care providers. But we want everybody to get back in and get their wellness taken care of for the year, and hopefully get tuned up for sports physicals as we re-enter our sports time over the course of the next few months.
Relating to that question, they also asked, what are some of the things to keep an eye out with regard to that type of illness?
Sure. So a lot of the autoimmune type processes that occur associated with some type of a rash and persisting symptoms. So a lot of times what we will see is a patient will get some type of a viral illness. They'll get a rash associated with that's typically associated with the illness. The illness comes and goes, and then there is a development of symptoms in the period of recovery after that. Kawasaki's disease, other diseases like that frequently will have dermatologic presentations with symptoms of the ears, nose, and throat, some symptoms of the skin. And so it's important to realize that while the initial viral rash is super common, the rash and symptoms that come after those illnesses is extremely uncommon. So if you seem to have a child or a pediatric patient that goes through one of these type of viral illnesses and they get the viral rash in the first few days associated with the illness, don't be concerned. That's something that we frequently see. What we want to know about is if somebody has a prolonged illness where they don't recover in a normal period of time. Most viral illnesses take 3 to 5 days to recover, at a max maybe 7 to 10 days total. The rash is usually associated on the front end of that type illness and then typically resolves on its own. Any child that basically is not eating or drinking appropriately or having persistent respiratory symptoms should be evaluated right away. But the majority of the time, the illnesses that our kids get is something that's relatively short and they recover from relatively quickly, just over a few days. We always encourage people to make sure that they're keeping their child hydrated well. We've talked a little bit in the past about medicines to use or not use in terms of anti-inflammatories, Tylenol, ibuprofen, things of that sort. It's certainly okay to treat fever associated with this. We tend to prefer the Tylenol in the pediatric population, but we want to know if for any reason that child is seeming more ill over the course of the illness rather than recovering normally, we'd like to see them right away.
And to continue talking about kids, someone asked if it's okay to allow play dates again.
So there's the nationwide answer, and then there's the local answer. I can tell you that as things have opened up, my family has been going out with all of their cousins and participating in normal activities. I think the thing to keep in mind is that as we continue to expand that, a lot of families have decided on a core group of people that their kids are going to play with. And I think that's a good way to kind of step into this. We're not having large congregations of people based on our stepwise plan to continue to open things up, and I think that's a good policy to keep with our kids as well right now. The activities as far as sports training and practices and things like that, I've been asked a number of times about that, whether that's okay. And my initial answer primarily is it depends upon what that close contact is. Probably activities such as soccer, things like that, where kids are starting out, I think that's perfectly fine. We've seen a little bit of activity as far as baseball and softball. I think that's fine as well. But what we need to keep in mind is limiting those large groups and those large populations altogether at one time. So the answer in our world is yes, our kids are getting out and playing with their cousins, but we're not expanding that out into a larger population as of yet.
Yeah, and I would just add that it's not a one-size-fits-all. We go back to, in those small groups, hand hygiene, and if those play dates or small groups involve food that you're looking at, do you bring your own food that is packaged for your family rather than having something that is a smorgasbord, grabbing a lot of hands going into bags of chips or that type of thing. And then on the youth sports, I know I've talked with the youth soccer group as well as the youth baseball group. Both of those organizations are resuming practices based off that stage 3, May 24th, and then looking at that June 14th as the date, if you follow the Indiana program that allows for the recreational sports to open back up for the competitive games and that type of thing. But just like all businesses, that will have a different look and feel to it. There will be spectator expectations around spacing, for social distancing, around how concessions work, around how the restroom access work. Any of those areas that could potentially harbor virus transmission are going to look a little bit different, and it'll be important that you and your young athletes are attuned to what those expectations are, so that we can make sure everybody gets to return to those activities that we're itching to do so in a safe way.
Hey, you mentioned a little bit about the anti-inflammatory medications. Is it okay for, say, adults to begin taking that again?
Sure. We've had a number of patients that have inquired about whether it's okay to take anti-inflammatory medications, and certainly it is. The initial reports on that were what we call anecdotal, so there wasn't a lot of research based on blinded studies to determine if that was okay or not. That's something that was carried over from a lot of the European nations where they don't tend to use anti-inflammatories in viral illnesses. But certainly my population of patients who has asked if it's okay to use their arthritis medications, their headache medications and things like that, I have absolutely cleared them for using those. There will be more ongoing research looking into that, but as of right now, that's perfectly fine to open that back up again and use those medications.
And then regarding the testing site, someone from Illinois asked if they're eligible to be utilizing that site. Do we know that?
To my knowledge, the screening questions does not have a demographic question for location of residence. Went on there and looked at it as it was opening up, and it was really about the symptoms and work environment and some questions about health just for the at-risk population, underlying lung disease, heart disease, those types of things. I've not heard of a specific case of somebody from Illinois being tested there. I can tell you that from an Illinois population standpoint, somebody that has symptoms and gets evaluated through our convenient care, we care for patients from Illinois and Indiana, so certainly could be tested at our convenient care. You're assessed by a provider on site, and so not everybody coming through there gets tested, but we really have relaxed a lot of our testing. So somebody that meets those high-risk criteria or is exhibiting symptoms consistent with coronavirus, which have continued to grow, and symptoms will be tested.
It's important to realize, too, that because we are a border state and Illinois is still basically locked down, that we have a large population that's coming over from Illinois. It's important to realize, though, that the number of cases that are in southern Illinois and southeastern Illinois is also extremely low.
Right.
So it's not a complete hotbed of activity for COVID-19 as we cross the river. They are living in a very similar environment as far as the virus is concerned as what we are. So although the state is living by the full restrictions, the population that is closest to us is in very similar state as what Indiana is.
Okay, another question is, somebody made a comment, I've seen some hospitals are checking x-rays for months prior to the outbreak to find out how long it has been in our area. Is our hospital doing this? This lady says that her sister died with the same symptoms, so that's why she's curious.
There were initially some suggestions or reports that x-rays or CT scans of the lungs were maybe more beneficial in diagnosis. That is not something that's commonplace, and it's not something that we retrospectively or retroactively go back and look at, specifically looking for illness. One of the controversies that's out there right now is what's being labeled as a COVID-related illness or a COVID-related death. And some people believe that is more on the liberal side, and some people think that that's more on the conservative side. Thankfully, we've had no deaths related to COVID here in our community, and the number of inpatients that we have had has been extremely, extremely small and have come from outside of our community. So the most important thing to realize that we've talked about repeatedly is the fact that the majority of the population in our community that has had this illness has been managed as an outpatient, have recovered, and returned back to normal activities out of quarantine. So again, hotspot areas versus the rest of the world, we're thankful that we are in more rural areas and that our surrounding communities have been very fortunate to be somewhat spared based on this. But no, that's not something that we have routinely been looking back at.
So for those that are traveling, or maybe they've traveled away from home for an extended stay in another state, should that be a self-quarantine period whenever they return?
So there's a lot of factors that play into that. The key element being where was that travel and how open were the restrictions on that travel. Were you traveling to a family member's house? You stayed in close contact with just that family and were not out and about in that community. And what's the presence of coronavirus at the location that you traveled to? So was it a hotspot or an area that had widespread transmission? And then the most important factor is, as you're returning, do you feel you were in contact with somebody that was exhibiting symptoms? Are you or any family members exhibiting any symptoms? And then erring on the side of caution and a self-isolation, self-quarantine would be appropriate. From a employer standpoint, employers are taking, I would say, a varying degree of approaches with that. We have travel restrictions, and with our travel restrictions here at Good Samaritan, everybody fills out a travel form if they are traveling outside of the region, and then that's evaluated by our infection prevention team, close monitoring of symptoms, but it is not an automatic quarantine for individuals.
Okay, and then there's a question about large gatherings, such as fundraisers. So someone says, regarding a fundraiser large gathering in October, will the social distancing still be in place then? Do you recommend to continue as planned or try to reschedule for spring 2021?
Well, that's a very loaded question.
I've had a number of these phone calls for me to pull out my crystal ball, and I can tell you that the people who have asked me about events that have been planned in June and July, I have suggested that they push those back. Moving more towards the fall, August, September, October, personally, I think that right now, I think that things will be more open by that time. If we continue to progress through our last stage as far as the opening plan is concerned, then certainly there should be very limited restrictions as far as that's concerned. The reason that I'm a little cautious about June and July is primarily because this is very fluid. As Adam has stated, this is something that we look at every day, that the state looks at on a routine basis, and those numbers can change. And so although we have an opening coming up again on the 24th and then again on July 4th, those are all subject to change as we move along. So I've been asked about weddings and graduation parties and a variety of events like that. And so I think just to err on the side of caution, knowing all the things that it takes to put those events together, if they're in June, I would certainly push them back. And if they're in July, being an organizer myself in the past, I would probably push them back as well.
Yeah. And I think hand hygiene plug again is that if you are an organizer of a fundraising event, you're looking at that August, September, October timeframe where we anticipate there will be very limited to no restrictions on the gathering sizes and that type of criteria. There is still going to be an expectation of the fundraiser organization or any organization to have hand hygiene accessible, to have in place potentially social distancing guidelines that may be tweaked or changed, but there's certainly going to need to be a thought process in setting up any event, I would suggest through 2020, that is cautious of potential transmission of a virus.
Okay, looks like all the questions.
Okay.
Thank you.
All right.
Have any other things that you have for us this week?
No, thank you. As we continue to reopen, really positive that since May 4th to May 18th, we've seen 2 cases, and I feel confident in saying that those additional 2 cases weren't tied to reopening and a negligence of any sort by anybody towards how we're reopening. I would say that the guidelines allow a lot of latitude for individuals to make decision-making on, do I wear a mask? Do I not wear a mask? How am I social distancing? Who am I around and how often? And everybody needs to be respectful of each other's decisions. And our own personal accountability is to make sure that if we feel ill or concerned or at risk, that we're not putting others at risk. And we're also not judging others for how they're handling that. And for that population that we have said is at higher risk, making sure that as a community we're taking care of them and helping them out as much as possible, because there are still 70-plus-year-olds that are at high risk that should be looking at this as almost a shelter in place to minimize their risk of illness, and we just all need to look at that from a community standpoint. I see a lot of things that are becoming very polarizing as to who's picking a side, and it's not a side. It's really just an approach that we're all taking, and we all need to be respectful of how that's going on in our community and beyond our community. That's my plug.
Great. Thanks, Adam. We'll be with you again in a week. If people have additional questions, please feel free to put those online. I'll try to address those throughout the day today. Thank you all for joining us.